In this video, we will discuss about the different types of TS abutment system available in the Ostem from the Ostem company. Okay, so in Ostem we have rigid abutment, transfer abutment, angled abutment, freeform ST abutment, gold cast, NP cast. These are the different types of implant abutment system available in Ostem. So you must have come across the freeform ST on the website, or the rigid abutment, the transfer abutment. So what exactly are these abutments, and when and where to use? How you can plan your case, and what all abutment you need to order for your particular case. In this video, we are going to discuss about all these things. So let us look at the rigid abutment. So rigid abutment in Ostem system is basically a single piece or one piece abutment. It is used as a cement retained. It is used for cement retained prosthesis. It is not a screw level or a screw retained prosthesis. Okay, so we can place a crown using cement only. And if we are using a rigid abutment, then we have to take a abutment level impression. Now we know that impression in implant can be either of abutment level impression or fixture level impression. So if we are using a rigid abutment, then we have to do a abutment level impression only. So for a rigid abutment, this much area is fixed with the implant screw. The gingival height is basically the area that is covered with your marginal gingiva, okay, from the crest of the alveolar bone till the gingiva. That is your gingival height. And here H denotes the length of the abutment that will be visible in the oral cavity. And D here is the diameter, that is the maximum circumferential area from the broadest part of the rigid abutment. Suppose your gingival height is 2 millimeter. So in that case, your rigid abutment height should be at least 1 to 2 millimeter more than your present gingival height. That is, it should be either 4 millimeter or 5 millimeter. So to select the correct dimension of your rigid abutment, you need to look into two important parameters. The first is your gingival height, that is the height of the marginal gingiva that is present from the crest of the alveolar bone to the gingiva. Also, you need to look into the height of the abutment, that is the extraoral part, that is the part that is visible in the oral cavity, the visible part, that is your height of the abutment. So these two important parameters you need to look after while choosing the exact dimension of the rigid abutment. Coming to selection of diameter of the rigid abutment or any other abutment you are planning to use, we have to look into the tooth's natural cervical area. Okay, so that is an important parameter. Suppose your cervical area diameter of the natural tooth is 6 millimeter. For that case, you have to use a 5 millimeter diameter of a abutment. So that will create a more natural emergence profile. In this diagram, you can see the blue part represents the diameter of the cervical area of the natural tooth, whereas the pink part shows the abutment diameter. So you can either use the diameter of the abutment same as that of the implant fixture, but that will not create a good natural emergence profile. Instead, you can use a diameter of abutment a little bit more than the implant fixture diameter. If you do that, it will create a more natural, realistic look. With a rigid abutment, you will get this kind of protection cap that is used for a abutment level impression. You just have to place this cap above the rigid abutment, and then you have to take the impression. So this rigid abutment is used only for abutment level impression, and the prosthesis is always cement retained. So where exactly to use the rigid abutment? The rigid abutment is suitable for single tooth replacement. Next we have the transfer abutment. The transfer abutment is a two-piece abutment. The impression type in transfer abutment can be either a abutment level impression or a fixture level impression, and the prosthesis can be either cement retained or screw retained or combination. So coming to the impression technique for a transfer abutment, you can either do a pickup impression, or you can do a transfer impression. Okay, so what is a pickup impression? For a pickup impression, we use the impression coping that looks like this as shown in the diagram, and the impression is mainly a open tray impression. Okay, and for a transfer impression we use a closed tray impression. And this pickup impression and transfer impression are both implant level impression. So keep in mind, the pickup impression is for open tray impression and the transfer impression is for closed tray impression. The other kinds of abutment available for single or bridge cases are angled abutment, free-form ST abutment, gold cast and NP cast. For overdenture cases, you can have a multi-unit abutment, multi-angled abutment, convertible stud locator, port-angled abutment. For single or bridge cases, the rigid abutment is a standard one-piece abutment, whereas the transfer abutment is a standard two-piece abutment. The rigid abutment is a one-piece abutment and it is used only for cement type of prosthesis, and we take an impression at the abutment level. Whereas for the transfer abutment, it is a standard two-piece abutment. We can have both cement or combination type prosthesis with it, and the impression level is possible with a fixture level impression. Okay, whereas abutment level is also possible, but we generally use a fixture level impression for a transfer abutment. So let's have a quick recap of the various abutment systems that we encounter. So I'm writing about the abutment system of Ostem. So we have three kinds of abutment. We have a rigid abutment, we have transfer abutment, and we have free-form ST abutment. Okay, so these are the three kinds of abutment we have. The rigid abutment is rigid. As the name suggests, we cannot modify the abutment. So cannot modify. Modify in the sense we cannot trim it, we cannot reduce its size. It is only used for cement retained prosthesis, and we have to take a abutment level impression. Okay, so simply you have to remove the gingival former or the healing abutment. You have to place the rigid abutment, tighten it with the screw that is given with the rigid abutment in the packet itself. Then you have to place your impression coping above it. Then you have to take the necessary impression with a closed tray, and once you get the impression, you have to fix the impression coping with the lab analog onto the impression and send it to the lab. Followed by this, you will get a crown which you have to cement it over the rigid impression with using a cement. Okay, so that is a rigid impression and rigid abutment, and it is mainly used for single implant cases or bridge cases. Okay, now coming to the transfer abutment and free form ST abutment, these two kinds of abutments can be modified. Okay, these two are modified, that is we can reduce the occlusal height of the abutment, we can reduce the overall diameter or length of the abutment. And okay, and they are mainly taken as fixture level or implant level impression. Fixture or implant level impression. That is, once you order the transfer abutment or the freeform abutment from the implant company, you don't have to place the implant onto the you don't have to place the abutment onto the implant directly. First of all, what you have to do is you have to remove the healing abutment from the implant. Then you have to place your impression coping, then take the necessary impression using either closed tray or the open tray method, whichever is required. Then you have to transfer the impression coping with the lab analog fixed to it to the lab. Also, at this stage, you have to provide the necessary transfer or freeform abutment to the lab. Okay, so the lab person will modify the given abutment as per the occlusal height and mesodistal space available, and you will get a customizable abutment which you have to place it on above the implant, and you have to fix the crown or the prosthesis using a screw. Okay, in some cases it can be either cement retained also. So these three are the most common types of abutment that we use in Ostem system. And the transfer on freeform, they are also used for single and bridge cases. Okay, single and bridge cases.